And here in Philadelphia, neighborhoods with the highest rates of COVID-19 infections are predominantly Black. So Gina, I wanted to start with you. Could you reflect a little bit on the figures that we just looked at showing higher rates of COVID-19 infection among Black Americans and among other communities as well, and tell us a little about your thoughts about why that happens?
I think it's important first to note that the racial disparities we're seeing here in COVID-19 really mirror many of the other racial disparities we see in other health outcomes, like maternal morbidity and mortality, cancer rates and death, chronic disease rates. And so, these COVID disparities aren't really a surprise. When we think, you mentioned some of the reasons why we might be seeing them. So some of those really immediate reasons, like you said, higher rates of chronic disease. So in Philadelphia, for example, in some zip codes in West and Southwest Philadelphia, which are predominantly Black, up to 50% of adults have a diagnosis of hypertension. There are more challenges with social distancing, which I think is one of the things that's reflected on that last graph that you showed. And so, social distancing is a key way that we can protect ourselves and our families from getting this disease and from spreading it. But not everyone can do that the same. And so when you think about Black communities and even poor communities, you have a lot more multi-generational homes. So you have kids living with parents, grandparents, and even great-grandparents. So it's much harder to separate kids who may be asymptomatic carriers of the disease from the elderly who are going to be higher risk. You also may have more people living in smaller homes and smaller accommodations. When you look at who are our essential workers, so, doctors and nurses, yes, but many other essential workers are low-wage workers and are predominantly minorities. So think about food services, environmental services or custodial staff, trash collectors, grocery clerks, bus drivers. I saw one estimate recently that only 1 out of 5 Black workers is able to stay home right now. So it's harder to work from home. So you're going out. You're more likely to have to take public transportation, not have sick leave, et cetera. You mentioned some of the environmental factors. So there's some early evidence that living in a neighborhood with high levels of air pollution is associated with higher morbidity and mortality from COVID. And Black communities are more likely to be in areas with higher air pollution. And then think about populations like the homeless. Blacks make up 40% of the homeless population in the country. Blacks and Latinos make up 56% of the US prison population. And so, people who are in prison by definition cannot socially distance themselves. So we know all of these things, but really we need to dig deeper and ask why. So why do people living in certain neighborhoods have higher rates of chronic disease? Why is life expectancy so different at baseline? If you look at in Philadelphia, Society Hill, which is one of the richest neighborhoods in the city, has a life expectancy of about 88 years. If you go a few miles north to Strawberry Mansion, which is a much lower resource, one of the poorest neighborhoods in the city, there's a life expectancy of 68 years. That's a difference in 20 years within a few mile radius in one city. Why are Black communities more likely to be located in areas with high air pollution? Why are low-wage workers who we have clearly deemed essential, who are vital to our functioning of everyday society, why are they paid so little? Why are they less likely to have health insurance and sick leave? And getting even further, why are our neighborhoods so segregated? Why are Black people overrepresented amongst the poor? And so you really need to dig deeper and ask why? And what you're going to arrive at is structural racism and structural and economic inequality. And so these are some of the very root causes of the disparities we're seeing in COVID, and more broadly the health disparities we see. And those are the things that need to be addressed in order to address all of these disparities.